A cystoscopy is first performed to determine the volume and location of the bladder tumors. Importantly, the ureteral orifices should be identified to avoid injury during tumor resection. Here, a smaller tumor is resected in a single motion, and the electrode is used to cauterize superficial vessels to maintain good hemostasis. Alternatively, large papillary tumors may require multiple passes of the resectoscope in order to debulk the tumor. In these cases, bleeding vessels are often difficult to access. Further resection of the bladder tumor may be necessary to identify the primary source of bleeding and provide adequate cauterization. There are two main ways to approach these types of tumors. Some urologists will debulk from side to side to flatten out the entire tumor, as shown here. Other urologists will resect in one location down to the level of the bladder in order to get an idea of the tumor depth before continuing the resection. It is important to note that resected tumors can develop an adherent quality during the debulking process. Therefore, the surgeon should push the resected specimen off of the tumor to avoid resecting the same specimen multiple times. For tumors located close to the posterior lateral bladder wall, where the obturator nerve can be inadvertently stimulated with the electrode, the staccato technique is a favorable option to reduce the risk of perforation. The staccato technique can also limit the cautery artifact of the specimen. In this clip, a tumor located very close to the ureteral orifice is resected with short bursts of electrocautery on cut current. You can see the surgeon giving a few pulses to reach an appropriate tissue depth while retracting the wire loop. There are many ways to collect specimen after a TURBT. If the tumor is small, you can manually pin each piece of tissue to the wire loop for removal. For more extensive resections, it is important to be efficient in specimen collection. The suction technique is commonly used to collect a large number of tumor fragments. In order to do this, the bladder is filled to near capacity. The inner sheath of the scope is then opened to create a suction effect where the specimens rush into the scope to be evacuated. This process can be repeated several times until the bladder is adequately cleared of remaining fragments. If the tumor is very extensive, a Toumey syringe or Ehrlich evacuator can be used to flush the bladder.